Good morning all. I am Dr. PJ Madam Rafi. Today we are going to discuss about migraine and its treatment. Okay. First, migraine is a unilateral pulsatile headache. Why? Because it is due to dilatation and inflammation of that is affected cerebral vessels. Okay. Due to dilation inflammation of cerebral vessels, it will cause headache. Okay. And one more thing also there. One more peptide is also reason for causing this migraine headache. That is calcitonin gene related peptide. Okay. This is recently identified. This CGRP protein or peptide. It will be also assumed that it is a principal mediator for triggering of migraine headache. Okay. This is an MCQ recently found out. That's why they may have chance to ask which peptide will be assumed triggering factor for migraine. That is CGRP. That means calcitonin gene related peptide. Okay. Next, coming to the treatment part. Treatment will be three groups: mild, moderate, and severe. For mild and moderate symptoms, we'll use only NSAIDs. Okay. For severe symptoms, we'll use ergometrin. Nothing but mild and moderate and symptoms will be. If you are having episodes, means if you are having one episode per month, it will be mild. If you are having 5 to 6 episodes in a month, that is will be more severe. Okay. So that's why mild to moderate symptoms will use NSAIDs only. So severe symptoms will have drugs like ergotamine, dihydroergotamine, and sumatriptan. Sumatriptan is a very important drug. Okay, this is a drug of choice for migraine. Okay, it is a selective agonist of 5-HT, that is 5-hydroxytryptamine 1B and 1D. Okay, that is 5-HT 1B 1D agonist sumatriptan. This is an MCQ. Whether they may ask drug of choice or which receptor agonist is, that is 5-HT 1B 1D. Okay, these are will cause cerebral vasoconstriction. Obviously, vasodilation will cause headache, right? So these drugs will cause vasoconstriction. So obviously, these drugs will contraindicate in ischemic heart disease. Why? Because they will cause coronary spasm. So we can't use in cardiac patients. So what are the alternative we will have in cardiac patients is intranasal butorphanol. Okay, that is first drug we use intranasal butorphanol, or we can go with droperidol if you are not beneficial with butorphanol. Finally, propofol. Okay, mostly butorphanol will be beneficial in cardiac patient. That's why butorphanol intranasal is the first drug of choice in coronary patients. Okay, in we have to remember very important. Sumatriptan will not be beneficial in this cardiac patient. Okay, they may can ask, they will give scenario like cardiac patient and what is the drug of choice. We will go with sumatriptan, but that is option is wrong. Sumatriptan will not be useful in cardiac patient because they will cause coronary spasm. So we can use sumatriptan. So what is the drug of choice? Intranasal butorphanol. Next drug will be droperidol if not treated with butorphanol. Final go we will go with propofol. That is anesthetic drug. Okay. Next, this is a treatment for mild, moderate, and severe. Next group will be prophylaxis. Okay, prophylaxis of migraine. First drug, important drug is propranolol. Okay, propranolol. Okay, this is a beta blocker. Obviously, this is most common repeated MCQ also. Prophylaxis of migraine. Which drug will be beneficial? Okay, propranolol. That is beta 2 blocker. Okay. Next, this CGRP receptor antibody that is recently identified, calcitonin gene related peptide. This peptide receptor antibodies like erinumab, frimanizumab, galcanezumab. Okay, galcanezumab, frimanizumab, or erinumab. These are recently identified antibodies. They can have chance to ask. Okay. Next will be CCBs, that is calcium channel blockers. In the calcium channel blockers, first drugs will most commonly use flunarizine. Okay. If it is not controlled flunarizine, we will go with diltiazem, verapamil, or imimodipine. Next is serotonin receptor blockers. Okay, in serotonin receptor blockers, drugs like methylsergate, cyproheptadine. Or tricyclic antidepressants will have drugs like this is also most commonly we use for migraine headache, that is amitriptyline, nortriptyline, or imipramine. Next group will be alpha 2 agonist, clonidine will have to use, or anticonvulsant drugs also will use in the migraine patients. That is topiramate is the first option will use in migraine prophylaxis. If not control, we will go with valproate and gabapentin. These are also useful in trigeminal neuralgia. Okay. So these are the groups of drugs we will use in prophylaxis of migraine patient. Okay. So this is the important thing we have to remember for prophylaxis of migraine. That's all. Thank you.